at 6.
About a week after it came in, Dane County says it is basically out of H1N1 vaccine.
And health officials say that means they'll have to decide which high-risk groups will get any new vaccine first. News 3's Mark Lovicott talked to a family with a little boy who falls into a high-risk category.
But we start with Linda Eggert with the latest on the county's vaccine supply. Linda?
Well, local health officials say Dane County's H1N1 vaccine is essentially gone. They're working on a new strategy now to fight that flu strain. And on Health Watch tonight, that will mean prioritizing which high-risk categories of local residents will get the vaccine first. Today, state and local health officials said adequate H1N1 vaccine supplies won't be seen until mid-November, a month later than expected. The local public health chief says there is enough nasal spray vaccine to complete tomorrow's scheduled school vaccination clinics. But after that, the county's supply is basically gone. A little bit at local hospitals is being used to immunize healthcare workers and, quote, a select few patients. But a rep for area clinic says they are still waiting for their vaccine. It's all part of a new dilemma, trying to protect H1N1 priority groups when the volume and timing of the vaccine supply is unknown. Local public health says the plan now is to prioritize the 5 high-risk groups and decide who should get any new vaccine first.
It could very well be that healthy children and healthy young adults in grade school, high school, and college may not be among the highest priorities. I think they likely won't be.
Schlenker says that means officials may alter the much publicized school vaccination clinics that started just this past Tuesday. School-age children are in one of the CDC's priority groups of persons between the ages of 6 months and 24 years old. Other high-risk categories include pregnant women, people who live with or care for children under 6 months, healthcare and EMS workers, and adults ages 25 through 64.
News 3's Linda Eggert reporting. Linda, thanks.
Our team coverage continues. News 3's Mark Lovicott in the news center with concerns from preschool parents. Mark?
Eric, these parents, many of them left worrying and wondering, but mainly they're concerned about when their child will be vaccinated or why they haven't been already.
Pediatrics, this is Heidi.
It seems like the phones never stop ringing at Associated Physicians in Madison.
When we do receive it in, we'll update our website.
Many of the calls from concerned parents about H1N1 vaccines for their preschool children.
Well, I think there's a lot of anxiety and fear out there.
We go to the pediatricians and there isn't an answer.
Katie Colbert is one of those concerned parents. She says she just can't seem to get answers.
Nobody can tell me anything.
One of Colbert's 3 children is scheduled to be vaccinated at school in 2 weeks. Her other 2 aren't in school, and a vaccination plan is unknown. Mom is most concerned about 4-year-old Brady.
My 4-year-old has had pneumonia 5 times, and there's a lot of fear right now.
And the important thing is that this virus is acting very much like the seasonal flu.
Pediatrician Elizabeth Neary understands patient concerns. Her clinic received their first H1N1 vaccination shipment just yesterday for staff and very high-risk children. Now they're out, and they're urging parents to have patience and not to worry.
Our nurses are doing a fabulous job talking to people on the phone and calming down the anxiety. I'm hoping that we have a good amount next week. So every week we're going to get a new amount. So it's coming.
My pediatrician says to call early next week.
Colbert questions how the vaccine is being distributed and why her high-risk son and others are being left out. She worries that because of the distribution process, focusing on schools first, her high-risk son may never get the vaccine.
That scares me now, too. Now is my pediatrician not going to have it?
And that is the big question out there now. Who will get the vaccine next and who will be next in line to receive it? As Linda pointed out earlier, we hope to learn the new plan of attack tomorrow or sometime early next week.
Guess patience, the key word. Easier said than done, though, in times like these. Mark Lovicott reporting tonight. Mark, thanks.